The wife of the Anambra State Governor, Nonye Soludo, has called for conscious and more intentional medical checks and habitual discipline to tackle the rising figures of cardiovascular-based diseases and deaths associated with heart-related issues. The Anambra First Lady, who is also the founder of the non-governmental organization, Healthy Living with Nonye Soludo Initiative, noted that most cardiovascular diseases can be prevented by addressing habitual risk factors such as tobacco use, unhealthy diets and obesity, physical inactivity, and harmful use of alcohol. She stated this on Monday shortly after her weekly statewide, healthy living walks and workout sessions in all 21 local government areas aimed at promoting awareness on cardiovascular risks and prevention. According to her, the seeming neglect by many people to go for routine heart checks has helped the increase in most cardiovascular diseases, including heart failure, cardiac arrest and stroke, which are the commonest among them. Recall that the World Health Organization reports that cardiovascular diseases are the #1 leading cause of death globally, accounting for over 17.9 million mortalities across the globe annually. In Nigeria, death counts from cardiovascular diseases are doubling annually, basically because of poor medical checks, negligence, ignorance, and other serious factors. Speaking on the dangers of cardiovascular diseases, Soludo said, "It is important for everyone to understand that deaths from cardiovascular diseases are usually quick and indefensible, especially when they are in their acute stages. Most cardiovascular diseases can be prevented by addressing habitual risk factors such as tobacco use, unhealthy diets and obesity, physical inactivity, and harmful use of alcohol." Healthy living plays an important role in finding solutions to cardiovascular deaths. Engaging in regular exercise and eating healthy and organic foods are just as important as checking the condition of the heart more often. She also urged the people who are at risk of cardiovascular diseases due to hereditary reasons to be cautious of their overall health habits and avoid lifestyles that can exacerbate the underlying problem. Soludo further stated that one of the primary pursuits of her NGO, Healthy Living with Nonye Soludo, is to establish a philosophy of well-being that will live in the consciousness of people and help them stay away from disease threats, including those arising from cardiovascular setbacks and wrong dietary choices. Health is wealth, health is everything. If you are healthy, you don't know what God has done for you. Healthy living and eating right are things we can do for ourselves, engaging in exercise and eating natural foods. About 90% of illnesses are a result of our actions. There are new cases of illnesses every day. From healthy living, we can start by spreading the word to everyone around us, our neighbors, which is why I promote backyard garden. Having it will help you track what you eat. It will help you eat natural foods. Consistent discussions about what you should do to achieve good health shouldn't ever bore you. In fact, what should really worry you is the absence of it. Health is everything. You probably don't appreciate it enough because you really don't know how blessed you are to be hale and hearty. Think about this as you have a blessed week ahead, she added. Punch Online on October 2025 reported that Soludo led a healthy living walk across communities in the state to promote physical fitness as well as raise awareness on healthy eating and disease prevention. The walk, which began in Aroma in Aka, brought together government officials, health workers, students and residents who walked through major streets in the state capital and into various communities. Soludo described physical fitness and healthy eating as a preventative measure against diseases like cardiovascular issues, and stressed the importance of good nutrition for both children and adults. The Anambra First Lady expressed excitement that communities in the state are now emphasizing that physical exercise should be viewed as medicine for healing and well-being.